All right, welcome to Poplar Pulmonary Wellness. Today we have a guest speaker in house. We are joined by Farouz Siraj, who is a pharmacist out in Victoria, BC. Welcome, Farouz.
Hello, thank you so much for having me. And hello to the audience. My name is Bruce. I am a pharmacist located here in Victoria, BC. So happy to be here. So happy to have this conversation. Hoping that I provide some information about what pharmacists can do, what our roles can be in the community pharmacy, and what you can expect from a pharmacist when it comes down to your respiratory needs.
Perfect. Yeah. I feel that some people realize the value of a pharmacist and they build up a really good relationship with their pharmacist and end up reaping the benefits from the education and knowledge that a pharmacist has. So maybe, Cruz, if you could sort of elaborate on why people should have conversations with their pharmacist and maybe explain some of the roles that a community pharmacist can take on.
Absolutely. Yeah, no, I love the fact that people can go and access pharmacists on a regular basis. We're one of the most accessible healthcare professionals. I think the funny term in pharmacy school we learned is that there's just as much pharmacies as there's Starbucks around the corners. So that's how many of us are available. And we're always open, Monday to Sunday, open to close. We're one phone call away. So it's nice to be there for patients and be a part of the healthcare system. So when it comes down to what to expect from a pharmacist, the basic things that we do when you come in, we can counsel you on your medication. We can provide some advice for over-the-counter things. We can also do more than that. There's a big myth that pharmacists just count pills and label it and just give it to you. That is not what we. That is pretty much not what we do. Most of that packaging and stuff gets done by our assistants, but we for sure, when you come into the pharmacy with a prescription, we assess the prescription to see if it's appropriate for you. So meaning that, do you have any allergies to it? Do you have any drug disease issues with that medication that was prescribed? Is it at the right dose? Is it safe for you? And once we determine that it is okay, we package it and we get it ready, and then we go over the medication with you. So the basic things we'll tell you about the medication: why is it given, what it is, how it might work, and what the dosages are, what you can expect for its efficacy wise. So how it's going to improve your issue, some side effects, and if there's any drug interactions, what to do about it. And those are the main basic things that we do when it comes down to prescriptions. But we do other things as well. And as you know, for the last 3 years, everybody's getting their immunization from the pharmacy, right? So your flu shot, your COVID-19 shot, but we're doing other vaccines as well. In British Columbia, we can do any vaccines. So that could be for your travel vaccines, it could be for shingles, it could be for pneumonia. All vaccines we are allowed to do. In October of this or last year, October 14th, the ministry removed a lot of restrictions. So before we were not able to inject other things than vaccines, so now we can inject other drugs. So if you have, for example, vitamin B12 that you need to get every month, we can do that for you as long as you have a prescription from a physician or a nurse practitioner. We can do that for you, which is awesome, right?
It is
So that
awesome.
means
Convenience for people, right?
exactly. Or you might be taking a antipsychotic medication that needs to be injected. So instead of, I had patients who, say, this is amazing. Like you said, it's very inconvenient. Before that, they would have to schedule an appointment, miss a day of work, go in just to get their shot. Now they just drop in and get their shot on their right away. So it's very convenient for patients, and it's awesome for us to, utilize their skills, because we learned these skills way before we were just not allowed to do this. So now we just do them as well. So immunization is one thing that we do. We also do medication review. We can also adjust some of the prescriptions. There are some limits, but again, if for example you bring in something that we know that the dose is not appropriate, we can change the dose to make sure that it's appropriate and safe for you. And again, it depends on the pharmacist's ability and their comfort level. There's other things as well beyond that. There's smoking cessation program, and June 1st we'll be able to prescribe for 21 conditions and contraceptives. So this is something quite new to us. It's technically not really new in the pharmacy world because our neighbors in Alberta have been this they have this ability to do prescribing for more than these 21 conditions for over 10 years. We're just finally catching up. They also have abilities to order labs, which we hope to get in the near future. But yeah, it's a quite exciting time to be a pharmacist and to be part of the healthcare team and to help patients and really, really needed in the community. So there's a lot of things that patients can expect from pharmacists when they come in.
Yeah, it's pretty exciting time right now in healthcare, and I see these changes that you're talking about as well in the healthcare system with pharmacists and that advancing the role and the duties that you can perform. One thing that people might be wondering is how to access a pharmacist and about coverage.
Mhm,
So we know we can go into a pharmacy,
mhm.
but what if a pharmacy isn't that close?
That's true. So right now, if a pharmacy is not close, there are online pharmacies that you can access. There are some really popular ones, Pocket Pills, I believe. They do deliver your medications. There's a few other online pharmacies that are available. You can always call them too, and you can directly talk to a pharmacist virtually as well. So there's that option for those for those people who don't live near any pharmacy. So that's really valuable for sure. In regards to coverage, so pharmacies, we technically don't do the coverage part. It's more about we're like the middlemen, as to say, um, because you bring in the prescription and you want to know if it's covered through your plan or if it's covered through pharmacare. So the most common coverage that most British Columbians will have, it's BC Pharmacare. So BC Pharmacare, it's something that all British Columbians are eligible to register for. It's free to register. We can also add in a link where if you haven't registered, you should, because it's free for everybody. It is based on a total family income. So based on your income, there's a yearly deductible. Once you reach the deductible, Pharmacare covers 70% of eligible medications. And once you reach the family maximum, then they cover full. Not all medications are covered, and some medications need a specialized authority. It could be because this is a higher costing medication and they need some bureaucracy to basically tell you that, yes, you do need this medication. So, this is where the prescribers of, for example, if you needed something for acid reflux, which we pharmacists will be able to prescribe for starting in June. Um, so let's say if you needed something for the acid reflux, you come in, we prescribe it for you, but then we have to fill out this extra little form that says, yes, you do need it. And then it goes through pharmacare and then it's goes towards your either deductible or it gets covered.
Yeah, that's an excellent point about the reflux medications, especially because as our clients with chronic respiratory disease take inhalers and corticosteroids, and asthma often goes hand in hand with reflux as well. So this
Mhm.
could be a common problem, and they're on regular medications. So it's great for people to learn about the side effects or the drug interactions. Often physicians don't have enough time to go over this with them, and they're not quite as thorough because the appointments are set times, but a pharmacist can certainly be a big value in that case.
Absolutely, absolutely, yeah. So, in regarding side effects, that's one of the things that we have to talk about, and that I actually like talking about with patients because I want to set them on the right foot. Just from my own experience, before I became a pharmacist, and I had to take medication, and if I had a side effect with it, I would stop the medication because I didn't know what to expect. So that's where I added my own little specialty into it, little own I guess, history. So, talking about medications and what to expect specifically about side effects is something that I take really highly on, and I put a lot of, I guess, a lot of weight on it because I don't want patients to go home, take something, and expect something or get something that they're not expecting, right? So, in regards to specific things about respiratory, so for example, if a patient is taking a inhaled corticosteroid, I always mention, I should say, that after taking the corticosteroid, inhaled corticosteroid, they should rinse their mouth with water. And the reason for that is that the inhaled corticosteroid, if it's not, again, rinsed out with water, it can linger and can cause oral thrush, which is a fungal infection. And treating that, it's not bad, but why go there if you can prevent that from happening? And then there's other side effects with oral corticosteroids. So common things that I'll mention with oral corticosteroids will be that not to take it at nighttime because it can keep you up, to take it with some food. And we want to also kind of look at the duration, the amount of dosing that the patient's getting, the duration as well. And based on that, we might need to slowly get you off the medication, because if we abruptly stop, then it can lead to something called adrenal efficiency, which can be dangerous. So we look at all these things, and it's so funny because we do it right here in quick seconds, and it's almost like you know something that we do without really thinking about it, just happening in the background in our brains all the time.
That's amazing. Yeah, it is so important. And even, I'd like to encourage our clients to talk to pharmacists if they do have a change in their symptoms. Maybe the doses needs to be changed, maybe the medication needs to be changed. And
Mhm.
certainly a pharmacist is a great first step. Yeah.
Absolutely. Absolutely. Yeah, so whenever you come to the pharmacy, if you do have any respiratory illness, actually any illness, but since we're talking about respiratory today, if you do have changes in your symptoms, definitely talk to the pharmacist. We love going over, inhaler technique to see if you're properly using it. We have lots of resources like demos that we can go over with you. We have videos that we can share. And we can also do a quick little assessment. So for example, a COPD assessment that I do is called a CAT score. So it's just a couple of questions that we can go over together. It gives you a little snapshot, or gives us a little snapshot of how things are going, and then we can see if we need to recommend changes in therapy, or add in therapy to make sure that your disease is better managed.
True. And in terms of managing disease, one thing that we teach is developing an action plan for all of our
Hmm.
clients. And pharmacists are certainly an integral part of an action plan. Medication is a big player in managing chronic respiratory disease, and certainly having prescriptions at the ready or even filled in advance of needing them is a
Hmm.
big part of action plans. And pharmacists know all about action plans.
Yeah, absolutely. That's such an important thing to have. I should see more people with action plans, and I don't. And an action plan can help you maintain your disease, and reduce the decline in your lung function as well. And just like you said, if you do need to, if your symptoms are, changing, the action plan will help you determine what to do next. So you might have some medications on hand that you may need to take. And instead of kind of guessing, the action plan is there. So you take the steps. So it's a great thing to have. And it's something that I highly recommend. And if you don't have an action plan, go talk to the pharmacist and see how the pharmacist, yourself, and your prescriber, they can all work together to create a good action plan for you.
Yeah, it certainly is a multidisciplinary approach these days. It's the best way to get care.
Absolutely.
Yeah, thank you so much for answering all of our questions. I just want to highlight again for people, go talk to your pharmacist, ask them about action plans, drug interactions, side effects, inhaler techniques. All of these things are super important, and pharmacists are accessible. They're out there. Just start the conversation.
Absolutely. Thank you so much for having me.
Thank you so much, Bruce.